as just now Dr. Renu said, this particular topic is very, very important. And you all know that it's a dream of all of us that we should have cervical cancer Mukt Bharat. And for that, you also know what is the importance of this particular topic. And when I'm going to highlight each and everything, what I want, the basic idea is that we should speak the same language. I think this presentation of ours must be something like 30th presentation. 30 बार तो हम लोगों ने पिछले 10 सालों में इसको present किया ही होगा. And still you find there is a lot of lacunae, and those lacunae must be sorted out. Sometime back we had HPV vaccination brought about by Serum Institute of India, and now 10 meetings are planned in 10 forums by MSD as well as by Serum Institute of India. So I think the clarity should be there, 100%. So today I'm going to talk about the science of HPV vaccination and recommendations. We all know that cervical cancer in India is a huge burden, which is absolutely 100% preventable strategy. You like to know that maternal deaths in our country today are 25,000 per year. But as far as the deaths because of cervical cancer is concerned, this is close to 75,000. To be exact, 73,000. 2023 data by the Government of India is that deaths because of the cervical cancers are 73,000 per year. It means 3 times the maternal mortality, which majority of the gynecologists do not know about this. With the effort of gynecologists, the burden of maternal mortality has come down tremendously in our country. But now the focus of all of you is requested to be on preventing cervical cancer. And you can see here that in India, we see 200 cases of cervical cancer per day, and every 8 minutes a woman is dying of cervical cancer. And there are 48 crores have likely to develop cervical cancer. It can happen to anybody. So it's a high time that we say big no to cervical cancer. Whatever we say, kaina dekhte ki it happens. But when we say collectively, it has a laser effect. HPV-related cervical cancer can strike at any period, at any time, and to any strata of the woman. You can see that there are certain celebrities. Shirika, who had been an Miss World, died at the age of 26 years after struggling for 2 years because of cervical cancer. Another celebrity from UK, television celebrity, Madam Goody. Again, she died at the age of 28 years, struggling because of cervical cancer, and both these cases had been picked up in cervical cancer screening cases. And the lady who is at 52 years, she had been the wife of previous Prime Minister of Australia, the longest Prime Minister of that particular country. When his wife had cervical cancer, he came public. He said, if my wife can have cervical cancer, what can happen to anybody else? This lady survived, and she worked very hard on cervical cancer prevention in Australia. Not only she worked in cervical cancer, she worked on a breast cancer as well. And you know, the name of the Australia has changed because of her action as far as the cervical cancer is concerned. Now, focusing on this mission of WHO. This came on the 17th of November 2020, and this is 90, 70, 90. And our focus today will be the first 90. This slide focuses that HPV infection is a huge burden in the world. It is thought about that it is 6 to 7% population globally has HPV infection. Now, as far as our country is concerned, certain data has come from premier institutes. I will just quote All India Institute of Medical Sciences. According to it, the infection is around 10 to 12%. And the people who have unhygienic conditions, there it is skyrocketing. While if it is, you find that if, their sanitation is better, that this particular rate is definitely much, much less. Now you can see here that HPV causes much more than just cervical cancer. So you can see the big spectrum here of HPV-related diseases and precancerous lesion and various cancers in both man and a woman. So this is a wide spectrum you can see here. We all know that HPV is necessary cause of cervical cancer and other cancerous lesion around anogenital region, oral mucosa, besides anogenital warts and respiratory papillomatosis. So you can see here that in cervical cancer it is responsible for almost 100% of cases. As far as vaginal vulval cancer is concerned, the incidence is much less. The anal cancer, it is to the tune of almost 90%. This slide shows that the overall HPV infection rate in our country, this is a little old slide, shows that around 6.6% people in this country have HPV positive infection. But just now I mentioned to you that the incidence is much more. Other day we were in a joint session of Indo-Egyptian ones. So that time they had said HPV infection in that country is around 12%. As far as genital warts are concerned, the incidence in our country is around 1%, and age-adjusted prevalence of CIN1, CIN2 is 2.3 and 0.5% respectively is there. You can see here that as far as India is concerned, 20% of the global cervical cancer occur in India. We are the super capital of cervical cancer. When the cervical cancer occurs in our country, it has got 5 years survival rate is only 50%. And this is because the people, when they reach the hospital and the doctor, it is already in stage 3 and 4. This is not the scenario in other countries. As you can see in this particular slide, that no age is exception that it will not have HPV infection. Women remain at risk for acquiring HPV infection throughout their life. This slide beautifully summarizes the same. People like me go to the extent that every time you have sex, you get exposed to new virus. So that story goes on right from before women menarche to menopause. As far as the cervical cancer in India is concerned, it occurs almost a decade earlier. It starts around 33, 34. It takes a peak at 55 years. And this particular reality we must all know. Almost 24 average years of life is lost because of the cervical cancer. Anywhere, more in our country. In India, the median age at the first sexual intercourse is 19 years. Engaging in sexual activity at a younger age has been linked to approximately twice the risk of developing HPV-related cancer and diseases in the future. जितना जल्दी होगा, उतना ज़्यादा आपको रिस्क रहेगा. People have a myth. I have one sexual partner. I don't run the risk of HPV infection. Here just I wish to tell you that 1 out of 2 women may be at risk of HPV even with single partner. Now, as for the pregnant or the postpartum women are concerned, they are susceptible to HPV infection. And this is because of the high prevalence of HPV infection is due to changed hormonal milieu and the decreased immunity. And that's why awareness in public is required. Now, focusing on prevention of cervical cancer. You can see this is the pyramid of cervical cancer prevention, which is made by the WHO. And you can see that the base of this pyramid of primary prevention is vaccination. It's very broad. ICMR says that if you give vaccination to any population, you bring down the incidence of cervical cancer by 50%. कुछ मत इंटरवेंशन करो, खाली वैक्सीनेशन दे दो, तो आपका 50% इंसिडेंस कम हो जाएगा. Now, this particular study has been done again by ICMR, well quoted outside. Majority of the gynecologists are ignorant about this particular study. Is that in case if you give screening, if it is done once, then the prevention is something like 52%. If the screening is done twice and you have vaccination, then it is something like 57%. But if you give screening 3 times and give them vaccination, the cervical cancer load in any population can come down to almost 65%. I'll come down to the experience of Western bird. Now, this slide is again $1 million slide, which shows that as far as the vaccinations are concerned, HPV vaccination stands tallest in saving the life of women. If you give 1,000 vaccination, you save 20 lives. आप 1000 वैक्सीनेशन दे रहे हो तो आप 20 जिंदगी बचा रहे हो. No other vaccination come close to it. The next vaccination which come close to it is hepatitis B vaccination, where you give vaccination and you save 1,000 vaccination, you save 10 lives. Now, what is the success story of the West in cervical cancer prevention? You know that they started screening program for their population almost 65 years plus years. 1960 में काम करना शुरू किया, screening their population with pap smear. And if they found precancerous lesion, they treated them with respective treatment. And they found that incidence has been brought down by 70% as far as the HPV infection is concerned, and as for the deaths because of the cervical cancers are concerned, it has been brought down by 80%. And now once they have added vaccination, they are close to almost 100% elimination. Now this slide compares Western figure as well as our own figure. The WHO has given call for 90, 70, 90 as far as Indian scenario is concerned. 0.1% of the population is vaccinated. And there also 60% is contributed by pediatricians and only 40% is contributed by gynecologists. Gynecologists are single people who are absolutely against HPV vaccination. ना तो खुद लेती हैं, ना अपने बच्चों को देती हैं, ना अपने डॉटर्स को देती हैं, और फिर जब इनको ही नहीं देंगी तो फिर पब्लिक को कैसे देंगी? मैं नहीं खुद बोल रही. These are Government of India figures. 0.1% vaccination. And what about the screening? हम तो बहुत काम करते हैं. The Government of India says 3% screening rate is there. ये 2023 के फिगर हैं. As far as treatment of precancerous lesions are concerned, less than 10% of our gynecologists are trained to treat precancerous lesions. And as for the Western world is concerned, when it comes to vaccination, they are from 50 to 90%. As far as screening is concerned, it is again 50 to 90%. And as far as the empowerment of the gynecologist is concerned, to treat precancer resolution, it is 80 to 90%. The Western world experience at the WHO has shown that with comprehensive approach to prevent, screen and treat cervical cancer can be eliminated as public health problem within a generation. Within one generation. Early WHO says that agar cervical cancer khatam karna hai to 100 saal lagenge. But now they have started telling it can be brought down within one generation. So the call is 90, 70, 90. Till now, only high-income group countries thought that they will be able to eliminate it. But WHO says, seeing the experience of European countries, Australia, that this can be a reality, it can be a dream of poor and the middle-income group countries as well. I admire this man when we were third-year student in Lady Hardinge Medical College. During our Golden Jubilee celebration, this man came. And जैसे अभी हम लोग रोते रहते हैं हर टाइम कि ये प्रॉब्लम है, ये प्रॉब्लम है, ये प्रॉब्लम है. So we asked him at that time also. So he says, I'm a teacher and I know a simple strategy. आप अपनी 10 प्रॉब्लम्स को लिख लीजिए और उसको एग्जीक्यूट कराइए पहले 10 क्लास में. फर्स्ट ईयर में 1 पेज, फिर 5वीं क्लास में 5 पेज और 10वीं क्लास में 10 पेज. और आप ये करके देखिए 10 साल में आपकी प्रॉब्लम सॉर्ट आउट हो जाएंगी. Whether it comes to स्वच्छ भारत अभियान or any अभियान, when it comes to students, things will be eradicated. So I feel, if you give 100% to 10 years in the schools, the magical effect is going to take place. And that is what the WHO has realized. So now let's talk about let's make cervical cancer Mukt Bharat. I'm going to just talk on HPV vaccination. Again, I repeat that 99.9% people in our country are unvaccinated. And 97% people are unscreened. And we also know the cervical cancer is one entity which is 100% preventable. This is the only cancer in a man and a woman which is 100% preventable. It's good that the government and the specialists are on the same page as far as the cervical cancer Mukt Bharat is concerned. And this term has been coined not by me. It has been coined by the government of India, cervical cancer Mukt Bharat. And I think to eliminate cervical cancer in India, I think effective strategy has to be critical. Because the job has to be done by the doctors and the medical fraternity, so they have to formulate a strategy for themselves. How am I going to empower myself to be contributor for cervical cancer Mukt Bharat? HPV vaccination to adolescent by the government of India is going to be a big game changer for cervical cancer prevention. Now question comes, government of India is committed to vaccinate adolescent girls. It means 30% of the women will be vaccinated against HPV by the government of India. What about the rest 70 to 80%? That has to be done by the gynecologists, by the pediatricians, by the medical officers, by the nurses, and the private sector has to also make a major play. And this will help government of India to achieve by 2030 to bring down the mortality of cervical cancer by 1/3. 1/3, not eliminate, 1/3. Now this slide shows you the story of vaccination as far as our country is concerned. The approval of HPV vaccination by the US FDA came in 2006. In 2008, the HPV vaccination, both Gardasil 4 and Cervarix came in our country. And by 2016, 10 years were over. And that time the WHO said that adolescent girls, instead of 3 doses, will require only 2 doses. So by now, it's almost 18 years since the time these vaccinations had been there. Gardasil 9 came to our country in 2021, while Cervical came in 2023. And this year, on the 8th of March, it has been rolled out for public use. Now you know about this particular vaccine, Cervical, which is our own Indian vaccine, which is a world-class vaccine. And now, quadrivalent vaccine, we have 2. Gardasil as well as Cervical. They have HPV antigen of against 16, 18, 6 and 11. And the efficacy is 98% with cervical cancer. And as far as 100% as for the anogenital warts are concerned. The vaccination schedule, you all know about it, about the Gardasil 4. Girls from 9 to 14 years, 2 doses, 0 and 6 months. Women who are between 15 and older, up to 45 years, there are 3 doses, 0, 2 and 6 months. Any question here? Are all of you clear? That's it. Now coming to Gardasil 9, which is a gender-neutral vaccine. Now as for the girls and women are concerned, 9 to 14 years, there are 2 doses, that is 0 and 6 months. And 15 to 26 years, there are 3 doses, 0, 2 and 6 months. As for the boys are concerned, it is only permitted in a country till 15 years, and the doses are 3, 0, 2 and 6 months. As for the Cervical is concerned, it is gender-neutral vaccine. It is for both boys and girls. 9 to 14 years, there are 2 doses, 0 and 6 months. And as far as 15 to 26 years are concerned, it is 3 doses, 0, 2 and 6 months. People ask, can it be given to 30 years, 40 years? No, it is only up to 26 years. So even any time you find boys and girls are more than 26 years, you cannot use Cervical. See, let me, I do not know myself. The trial had been done with the 3 doses between 9 to 15 years. And when the white paper came from the WHO, it only came for girls. Because anywhere in the country, in the world, 150 national immunization program, it was only given to girls. Later on, you know, Australia included boys. That is something different story. Now, Cervarix is not available in our country, and it is likely it will not be available in our country as well. Now, as far as the vaccine is concerned, it is to be stored at 2 to 8 degrees, not frozen, but protected from light. 0.5 ml dose has to be given in deltoid region. It has to be given by intramuscular route. And person must wait for 20 minutes in the clinic after giving vaccination, just like COVID. Anybody not clear about the doses? Now coming to WHO SAGE. Yes. Whatever vaccination we are talking about, it is relevant to our country. What is happening in Australia, what is happening in UK, what is happening in US? I'm not talking. I'm only talking what is relevant in our country. As far as Gardasil 9 is concerned, it is a gender-neutral vaccine. Because the studies in our country have been done for both for girls. Girls, it is permitted up to 26 years. 9 to 26 years. But as for the boys are concerned, it is only permitted from 9 to 15 years, and the doses recommended by, these people requested from the Drug Control of India, there are 3 doses, 0, 2 and 6. No change here. Is it clear, ma'am? Cervical is a gender-neutral vaccine. This is available both for boys and girls up to 26 years. आपने 9 to 14 की बात करनी है तो आपको 2 डोजेस देनी पड़ेगी, और 14 ईयर से 26 ईयर्स की बात करनी है तो 3 डोजेस देनी पड़ेगी. क्लियर? SAGE recommendations came in 2022. Why? Only 13% adolescent girls got the second dose. I'm talking of 150 countries. The second dose received in the National Immunization Program was 13%, which was equal to giving a single dose. So the WHO put their experts on the job, and they came out that one dose is equal to 2 doses. The choice lies with the government whether they want to give 1 dose or whether they want to give 2 doses. 1 dose is equal to 2 doses. But as far as our country is concerned, जब तक ड्रग कंट्रोल ऑफ इंडिया इसको ओके नहीं देगा, ये हमारे लिए जीरो है, इट इज इररिलेवेंट, मैं कंफ्यूज करूंगी. सो आप इसकी बात को भूल ही जाइए कि WHO सेज की रिकमेंडेशन हमारे यहाँ लागू होंगी. और जो भी डॉक्टर इसको रिकमेंड करेगा, अगर वो फंस गया तो उसको कोई भी डॉक्टर बचा नहीं सकते, चाहे वो स्टेट काउंसिल हो, चाहे वो नेशनल मेडिकल काउंसिल है. हम कुछ भी आपको सेव नहीं कर सकते. यू हैव टू फॉलो द लॉ ऑफ द लैंड. So, if you want to use less doses, that is, it will be off-label because DCGI has to give a control. It has to make a clearance, then only one can use it. Single dose schedule will not be followed till that particular time. Now, is it clear to everybody? Now, as far as HIV positive cases are concerned, because their immunity is already decreased, in spite of you give 3 doses, these patients need to be followed up. These patients need to be told earlier कि हम कोई गारंटी नहीं देते हैं कि तुम बचोगे बीमारी से. ये तुम्हारा फेट है, तुम्हारा बॉडी का सिस्टम है. Now, what is the primary target and what is the secondary target? For any government, the primary target is girls between 9 to 14 years. Idea is before they become sexually active. If 80% coverage is there of the girls, automatically infection in the boys comes markedly down. The secondary targets are boys between 9 to 26 years, older males, or men having sex with men. This is secondary recommendations. If koi sarkar कहती कि it is feasible, we have that kind of money with us, then it will not divert the resources from the vaccination of the primary target group. लड़कियों के लिए हमारे पास पैसा है, उसके ऊपर पास भी हमारे पास पैसा है, हम बॉयज को भी दे सकते हैं. But it cannot be given at the cost of girls. It is the respective government has to decide about the same. Now, co-administration of with other vaccine, is it possible? Yes. अगर एक ही दिन आप 2 वैक्सीनेशन देना चाहते, दे सकते हैं. एक इधर दीजिए, एक इधर दीजिए. बट आज हमने वैक्सीनेशन दिया, पेशेंट कल आती है कि डॉक्टर साहब मैं फ्लू ले लूं. नहीं, यू हैव टू वेट मिनिमम फॉर 15 days. इज इट क्लियर? क्यों मत पूछो मुझसे, क्यों नहीं मुझसे पूछिए. रिकमेंडेशंस आर रिकमेंडेशंस है ना. हम लोगों को बिना ब्रेन, ये ब्रेन दिमाग हमको घर में रख कर आना चाहिए. क्यों है उसके लिए वन हैज टू बिकम अ प्रोफेसर कि क्या है, और फिर इतने कॉम्पिटेंट हों कि हमें WHO में अपॉइंट करें एज ए एक्सपर्ट. देन ओनली वी विल बी एबल टू फाइंड इट. दोनों दे सकते हैं, उसी दिन दे सकते हैं, बट नेक्स्ट डे नहीं दे सकते, 3 दिन के बाद नहीं दे सकते, फिर आपको 15 दिन का गैप करना पड़ेगा. मेरे पास इस क्यों का आंसर नहीं है, और आंसर है तो भी बताना नहीं है. The special situations are, it is not recommended for use in pregnancy. पर आपने दिया, you find this month only she got pregnant, then the MTP is not required. Is it clear to everybody? If she got pregnant inadvertently, then MTP is not required. Lactating women can receive HPV vaccination. I'm going to talk in detail. It does not cause any adverse event in the mother and her baby. Now, as for the sexual assault survivors are concerned, Whenever you are examining these patients, they should be given age-appropriate HPV vaccination with the first dose at the time of initial examination. Women with abnormal pap smear, positive HPV test, previous HPV lesions can be vaccinated if they desire. They should be counseled that it is not a therapeutic vaccine and will not treat existing virus and pathology, and there is a reduced efficacy in older women. I will come down to that older woman topic also in the end. HPV is a primary prevention intervention and does not eliminate the need of screening. I told you every time a woman is exposed to sex, she gets a new virus in her system. The screening of the cervical cancer should be done as per guidelines of that particular country. Now, do both HPV vaccine, quadrivalent and nanovalent, offer the same protection against HPV infection? The answer is, चाय में जितनी चीनी डालोगे उतनी ही वो मीठी होगी. अगर नैनोवैलेंट वैक्सीन है तो उसकी एफिकेसी डेफिनेटली इससे ज़्यादा होगी. But we know about the quadrivalent vaccine and a bivalent vaccine. The WHO says the efficacy for the prevention of cervical cancer is 98%. I'm not available, and I do not know about any data from the MSD which says that Gardasil 9 is 100%. So anything between 99 to 100% is your guess. Many people say, I've given my daughter this particular vaccination, Gardasil 9, Gardasil 4, can I give Gardasil 9? People like me tell that it is not needed. It is not needed. Now, आपको भी ऊपर वाले ने ब्रेन दिया, आप अपना सोचो और अपना करो. आपने कोई एडवाइस नहीं देनी. Now, as for the postpartum period is concerned, awareness about HPV and its vaccination among pregnant women is low in India, and is an urgent need for addressing this knowledge gap for increasing community awareness towards cervical cancer prevention through HPV vaccination. The prenatal period and the postpartum period provide an excellent opportunity for cervical cancer counseling and vaccination. Why? 95% deliveries are taking place in institutions today. 90% patients have a footfall in a gynae clinic. And this golden opportunity should never, never be lost. It should never be lost. Majority of the time, when the gynecologist sees a woman, she's already pregnant. So you should see to it that during this particular time, you counsel her well and give her in a postpartum period the vaccination. One can see that the higher number of normal pap smear result in a postpartum HPV vaccinated woman compared to the unvaccinated woman. There's a significant difference in postpartum pap smear results were observed between the vaccinated and unvaccinated group. Higher percentage of a normal pap smear result was observed in a postpartum HPV vaccinated woman compared to unvaccinated woman. So it goes without saying that it has relevance. My request with folded hands to all gynecologists is that available evidence does indicate increased risk of adverse. It does not have any adverse events linked to vaccine, either to the mother or to the babies after the administration of HPV vaccination in lactating women. So they are safe, both for the mother as well as for the baby. Now, vaccine immunogenicity was comparable among nursing mothers and a woman who did not nurse during the vaccine administration. And the adverse reaction was the same, which was absolutely minimal. So it is well tolerated and safe during the postpartum period. And then what do the guidelines for breastfeeding recommend? I've brought only 4 guidelines here, but there are 13 guidelines which to say that the breastfeeding is not contraindicated for HPV vaccination. So everybody recommends that this particular golden time should not be lost. Now, which HPV vaccination you should give in a postpartum period? Bivalent, there was no study. So it could not be given, even when it was available. Cervical has also not done any study on a breastfeeding. Whatever, if they're doing it, it's there, it has not come out. So what you can use? You can use quadrivalent vaccine is recommended through age 9 to 45 years in girls and women. You can use nanovalent vaccine and quadrivalent, Gardasil 4 from 9 to 26 years. You can use both. But after 26 years, you have to use only Gardasil 4. Is it clear to everybody? 26 साल तक आप गार्डसिल 9 भी यूज कर सकते हैं और गार्डसिल 4 भी यूज कर सकते हैं. 26 साल के बाद आपको खाली गार्डसिल 4 ही यूज करना है. You can't use Cervavac here because there is no study has come as far as the breastfeeding mothers are concerned. Is HPV vaccination beneficial after childbirth? My request to each one of you is please be enthusiastic to use HPV vaccination in postpartum period. Same thing here. Up to 26 years, you can use both quadrivalent and nanovalent, and after 26 years, it is only Gardasil 4. And the dose schedule remains 3, 0, 2, and 6. Is HPV vaccination effective in sexually active women? Here, gynecologists got stuck. 99% gynecologists get stuck here. उनके हिसाब से वैक्सीनेशन खाली before the child is exposed to sex, it should be given. That's wrong. The study has been done by Gardasil 4, and they found that 0.4% women are infected with all 4 HPV viruses, 16, 18, 6, and 11. It means 99.6% will be benefited because of HPV vaccination. This is the slide. They took 2 groups of sexually active people. One was 16 to 26 years sexually active. And they said that 99.9% of the women will benefit because of vaccination. And in the second group, it was 24 to 45 years, and they said 99.6% women will benefit with HPV vaccination. Any question from anybody? This I'm repeating for the second time in this presentation. Can HPV cause fertility issue in future? There is no evidence that it is related to future infertility or any miscarriage problem, premature labor, or any other type of pregnancy complication. This is the same, many bodies approving postpartum vaccination to be given safely. As for the vaccine safety is concerned for all HPV vaccine, no serious safety issues have been reported till date. Occasional case of anaphylaxis there which can occur to any woman. As for the Cervavac is concerned, again I will tell you, no follow-up data of the Cervavac is available for 10 years so far. Another 2 years it will take for that coverage. Now, as for the safety profile of quadrivalent and nanovalent vaccine is demonstrated for over 20 years of clinical development and real-time experience. And you can find that thousands and thousands studies have been done for their safety. This slide you can see here, females they have taken from 9 to 15 years, and they found 0 breakthrough as far as the genital warts was concerned, 0 breakthrough was concerned, high-grade intraepithelial lesion, 100% effective, and 10 years data is available. From 16 to 26 years, there was no breakthrough of CIN3 and above, 100% effective, and 10 years data. One can see here, they have divided again males and females, and they found there has been 0 breakthrough for both categories, up to 26 years. So you can see there are a lot of material, future 1, future 2, future 3. I'm not going to bore you with this. as far as the nanovalent vaccine is concerned, again, same criteria. Genital warts, high-grade intraepithelial lesions, both categories 9 to 15, and again 16 to 26 years, no breakthrough. So finally coming to the final slides, HPV is the most common sexually transmitted infection. Persistent infection can lead to development of anogenital warts, precancers, cervical cancer, and other anogenital cancers in women. India contributes to 1/5 of the global cervical burden, and combining cervical cancer screening along with vaccination can reduce the cervical cancer risk by 63% according to our ICMR data. And I've told you what is the word data, which is coming close to 100% once you give them vaccination, screening, and treatment. Majority of the women in India visit gynecologists during pregnancy, making it good opportunity for the cervical cancer counseling and giving vaccination in postpartum period. The HPV vaccination demonstrated the effectiveness with good tolerability, both in girls, boys, and women. The various guidelines recommend HPV vaccination in the postpartum period and in lactating women. So time has come to say no to cervical cancer, and gynecologists can make a big, big difference as they have done it in front of maternal mortality rate in this country. I'm the ambassador. I want you to also become an ambassador. If people who do not have this, who are working on it, who are giving vaccination, who want to become the ambassador, I have got few leaves with us. You can take it from us. But in case it is not to be kept just like that in your this thing, if you're very serious about it, I have brought 4 leaves, you can take it. Majority, otherwise we will send it across to you. You can make a copy of it and you can put it on in your waiting area of your patients. So thank you very much.